Hi everyone, my name is Tumishe from Tumsel Aware. Today we'll be talking about medications that help manage sickle cell disease. And today this post will be very informative and engaging, and to make easy for every one of us to be able to comment and tell us more about the drugs you have been taking as a sickle cell warrior. So managing sickle cell disease can be challenging, but the right medications can make a world of difference. Today, we are breaking down some of the most common medications that help sickle cell warriors manage their symptoms, reduce crisis, and live healthier lives. Whether it's reducing pain, preventing infections, or managing other complications, medications play a huge role in living a healthier, more comfortable life as a sickle cell warrior. So number one on my medication list is hydroxyurea. The purpose of using hydroxyurea is that it reduces the frequency of painful sickle cell crisis, which reduces the formation of sickled shaped cells, and the side effects may cause nausea, skin ulcer, or low blood count in some patients. So I told us that the main role for hydroxyurea is reducing the frequency of crisis, and it helps in increasing fetal hemoglobin. But yeah, for me, I haven't taken hydroxyurea before. My hematologist haven't recommended hydroxyurea for me. So hydroxyurea, the hematologists have to recommend an hydroxyurea before you can take it. You can't just go to the pharmacist or any clinic and just say, I want to take hydroxyurea. It has to be recommended. And number two is folic acid, which is vitamin B9. The purpose of folic acid is that it supports the production of healthy red blood cells, which is crucial for people with sickle cell, and it helps the body to produce new cells so that it can replace the ones destroyed in sickle cell anemia. Well, when it talks to side effects of folic acid, I would say that it's rare, but some may experience mild digestive upset. For me, I take folic acid daily to support my body's production of red blood cell. So it's one of the easiest supplements to manage with few side effects, of course. And it is very affordable. So let's cross to pain relievers. Example of pain relievers, we're talking about ibuprofen or acetaminophen. The purpose of these pain relievers, they help to manage mild to moderate pain during a crisis. So these medications reduce inflammation and block pain signals. I would say the side effects is that long-term use of this ibuprofen or acetaminophen affects the liver, kidney functions, and sometimes it causes ulcer. So we need to use these pain relievers and opioids. We need to use them with care. We need to use pain medications safely, especially when dealing with severe pain crisis. Well, on my other pain days, I stick to over-the-counter pills, like I've said, like ibuprofen. But during a crisis, opioids like morphines may be necessary. So it's important to only use them under a doctor's supervision. And I also find that alternating between ibuprofen and acetaminophen works best for my pain flare-ups. And like I said, opioids, they are for severe pain and can't be controlled with over-the-counter medications. I mean, you need your hematologist to prescribe an opioid pain meds for you, because opioids interact with your nerve cells to block pain sensations, and the side effects are drowsiness, nausea, and potential for dependence. So addiction, like one can be addicted to opioids medications. So use only under medical supervisions. Well, I can say I only use opioids when the pains are very unbearable, and I work closely with my doctor to manage their effects. And I think it should be used with severe care, and it should be used in severe pain crisis. You can't just take opioids just because of you are having mild pain, and because it's really affects your dependence on it, and it makes you addicted to opioids. Opioids are very, very dangerous, so we need to be careful when taking opioids. And the other one I'll be talking about is antibiotics, e.g. penicillin and others. So the purpose of taking antibiotics is to prevent infections, especially in young children with sickle cell. So how antibiotics works, it prevents infections like pneumonia, which can be dangerous for sickle cell warriors. And the side effects will upset stomach, allergic reactions in some cases. So it is very, very important to be able to know the importance of antibiotics and to prevent infections, particularly for children. So as a child, I was on antibiotics like penicillin to prevent serious infections like pneumonia. So it's essential to stay proactive about preventing illness, as infections can be more dangerous for sickle cell patients. Now let's talk about blood transfusions. Now the use of blood transfusion is that it increases red blood cells and treats complications like anemia or stroke risk. It provides healthy red blood cells, improving oxygen delivery throughout the body. And I would say the side effects is that risk of iron overload, which requires monitoring and treatment. So blood transfusions are sometimes very, very necessary and needed, because sometimes when the pains are unbearable, the hematologist can advise for blood transfusions. And blood transfusions have always been a life-saving treatment for many, but it's crucial to monitor iron levels, as repeated transfusions can lead to iron overload. Well, I would say personally, I haven't taken any blood transfusions, and no, I haven't taken any blood transfusions. So, dear followers, what medications have you used to manage your sickle cell? Have you experienced any side effects? Share your story with us in the comments below. Don't forget to share to be able to spread awareness. Share, comment, and share, comment, and like. This is Tumishe from Tum Cell Aware.